Okay, assessment number 3. Sternocleidomastoid, tender, has a stiff neck, decreased range of motion to opposite side. Is there decreased range of motion in lateral side bending? When you get into the SCM, the long head rotates it to the opposite side. And the short head, down by the collarbone, it side bends to the opposite side. So when you have difficulty, there's a way that we can help get more range of motion in there by clasping that down and doing some techniques that I'm going to show you. So my finger pads are going down to the lamina groove, and it's going into the facet joint area. And you want to this is kind of a motion where you'll be motioning this here, but also clasping against the sternocleidomastoid, pinching it, and you kind of rotate the head. Kind of doesn't do anything, they just lay there. And you just kind of work the whole SCM. The whole SCM. You just kind of, so you're rotating the head as you're doing this.